Hello, Dr. Devoskin here with Injury Doctors NYC with our patient today talking about motor vehicle accidents and the potential complications and issues that arise. Please say hello. This is our lovely patient today. Please tell me what happened.
So I was a passenger in a taxi cab that was rear-ended.
Okay.
And I've been feeling a lot of back pain since.
And did you start having pain right after the accident or did it come later?
So I started feeling pain about 2-3 days later.
Okay. And what did you do at that time?
I just tried to relax, put some compress on it, took some Tylenol, Advil.
Okay.
But that's persistent.
Were you seen at the hospital after the injury?
I actually didn't make it to the hospital.
Understood. And what body parts are injured from the accident?
It's mostly my lower back, but I do feel pain probably down my right leg.
And the medications that you mentioned, Tylenol and ice, do they make a difference for you?
A little bit temporarily, but since then, it's stopped.
Have you seen a physician, whether it be your primary care or a specialist at this point? Got it. Have you done any physical therapy thus far?
Just some home exercises.
Understood. And so tell me a little bit more about this back pain. Where does it start? Where does it go? What makes it worse?
It's kind of at the very bottom of the back. And then anytime I walk or bend over to put my shoes on, I feel a sharp shooting traveling down my leg.
Understood. And you said anytime you flex forward or anytime you walk, it makes it worse. How would you describe your pain? Is it a sharp pain or more dull and aching?
It can be dull and aching from just sitting around, but when I bend over, it's sharp.
Understood. Is there any burning, any numbness, any tingling with the pain?
Now that you mention it, I do have some tingling in the
Outside of
toes on the right foot.
Got it. And my other question is, any trouble with weakness?
I have noticed some weakness on the right side. When I'm trying to climb stairs.
That's when you feel it. And I have to ask, but any issues going to the bathroom, any bowel or bladder changes? Excellent. Excellent. And then medications we discussed. Have you done any imaging yet? I know you haven't seen a provider, but you haven't done it yet. So the first part of the test is I'd just like to get an understanding of your nervous system and the nerves that run from your spine down to the legs. It's a very simple sensory test. If I rub here and I rub here, does that feel about the same? Okay. Here and here.
I feel a little bit less on this.
Okay. And what about here versus here? About the same. Here versus here.
A little less on this.
Okay. At the end, I'm going to ask you to take your shoes off, but we'll do that at the end. I'll check the sensation in your feet. So the very same thing, we're just going to use a little bit of a pin. And that versus that about. Got it. Here versus here. Okay. Here and here. Got it. And once again, we'll finish the feet at the end of the exam. Let me have you lift the hip up on the left. And now on this side. Excellent. Straighten this knee all the way out for me. All the way. Keep it straight. And pick your ankle up towards your head. Good. Push like you're hitting again. Excellent. Take the right leg, lift it up for me. So just a little weakness there. And how about straightening out the knee? Good. Okay. Hold your toes up to your skin. And then hit the gas. So a little bit of a difficulty there. Okay. I'm going to check if I stretch, and then you're going to lean a little forward. Try to lean forward for me a bit. Does that hurt? And what about here? Okay. Do you feel any additional pain or pull?
Just a
Got it. So I'm going to check your reflex here. Much better. Let me have you stand on up and turn for me. I'm going to just feel the back here. Tell me, if I push on the muscles here, does that give you trouble and pain? That's achy. What about here? Okay. Lean back for me. What does that do? And then left shoulder, left side down. Not too bad. And this way. And can you flex forward for me by trying to touch your toes slowly? Does that cause you any additional pain? And where do you feel that pain? Okay, stand on up for me. If you haven't done anything in terms of physical therapy, which would be the first step, trying conservative treatment, I'm going to give you a prescription In physical therapy, they'll teach you a lot of different exercises to strengthen your core. In addition to that, they may use modality of heat, ice, ultrasound to help decrease the pain. And they should also teach you structured exercises for home. In terms of medications, I would like to try a muscle relaxant with you to help some of the tension decrease, as well as an anti-inflammatory consistently for up to 2 weeks to see how you do. Okay? We'll reevaluate at that point. If your pain is getting better with treatment, wonderful, that'll be the best outcome. If, however, you notice that there is continuation of discomfort, we're also going to get an MRI. We'll take a look and see what is going on deeper down where the nerves run, where the discs are, and if there's any tears, any what we call herniations or pinched nerves, commonly sciatica type symptoms. You do have some sensation changes in the fifth nerve from the low back, as well as a little bit of weakness. Okay, hopefully it'll all improve with physical therapy. But I do want you to know that sometimes it is necessary for patients to have an epidural injection. It's an injection that goes into the back where the nerves run to help decrease the inflammation and pain. We'll see how you do, and we'll take it from there. Okay? Do you have any questions?
So, can you tell me a little bit more about the epidural injection?
So the epidural injection is something that we use to help decrease the inflammation and pain after a pinched nerve or any inflammation by the disc area, which can happen from a trauma or an accident. It's not the first treatment that we choose, first conservative management with medications and physical therapy. So the epidural itself is done under an x-ray machine or fluoroscopic guidance to make sure we're in the right place. We use a sterile technique to decrease risk of infection, and we also use contrast to make sure that the medicine is spread in the right area before actually giving the medication. There are things I want you to know. Commonly after post-injury, you could have first a sprain or a ligamentous strain, ligament pull. That's part of the pain, so if that goes away with treatment, you don't need the epidural. You could also have a deeper down issue with the tear of the disc or a herniation of the disc, and that could be causing an inflammatory reaction, irritating your nerve, or it could be actually pushing on the nerve. And that's the goal of the epidural, to decrease that inflammation and decrease the pain that you feel in that area. It works differently for different patients, and very commonly I have the question of how long will it last, and the answer is we find out together. Some patients do find months of relief, others find just several weeks to a month, so it'll vary, and we'll decide what to do next as it comes up and if we need to. Thank you for watching this video from Injury Doctors NYC to learn about the potential of what can happen after an accident. Please continue to follow. If you have any questions, please feel free to reach out to us via email or calling us directly, or if you have a quick question, we may be able to answer if you comment below. For more information, please follow us at injurydoctorsnyc.com.